chips and game for rats. There is a huge chart that is staring at us, and it is displaying three different lesions: squamous cell carcinoma, basal cell carcinoma, and malignant melanoma. In fact, any of this can be given as a chart for us, or it can be a question in the form of a short note, gross microscopy slide, or viva voce. Hence, it will be apt for me to call this chart within chart. Dear students, do not skip a single word of what I am saying. And I would like you people to assess the probable number of questions that could be asked from this chart. With this instruction, I would like you people to go to the first chart. And this is squamous cell carcinoma. All of us are very familiar. I will not be going into the theory of it. It can happen as a lung tumor or it can be a skin tumor. There are other sites where we can get, such as the esophagus, the oral cavity, the cervix, so on and so forth. Look at this picture. It is an amputated specimen of the leg. And I'm finding that there is a huge ulcer. The ulcer, you find it is large, measuring about 5 or 6 centimeters in diameter. And the tumor is bulging above the cut surface. It is showing evidence of necrosis and hemorrhage. This is another one. Again, the yellow ring is supposed to encircle the tumor. This is an amputated specimen of the penis that is showing a proliferating cauliflower-like lesion. So there are three types of lesions possible: proliferative, ulcerative, ulceroproliferative. And this is a cut surface of it. Again, the tumor is seen in the periphery, whereas the shaft is relatively free of tumor. In this case, it has replaced the glans penis. It is friable, grayish white or grayish brown, and it measures so many centimeters by so many centimeters. This is again a specimen which you people can see in any of the medical colleges. An amputated specimen with a fungating cauliflower-like friable growth. When I go to the microscopy, I find this is the picture. Look at this one. The classical thing that we see will be the pearls, the epithelial pearls. What is a pearl? It is a concentric deposition of one within the other. So this happens to be a word from the oyster secretion. That is a pearl that the women are wearing. Here the epithelial cells are concentrically arranged around each other. There is a central nidus which becomes eosinophilic. This is called an epithelial pearl. So if I count, I find that there can be multiple epithelial pearls in this one. The white arrow is pointing out to this. And this is the intervening stroma that is showing numerous small cells, namely the lymphocytes. So this is again an epithelial pearl. Look at this picture. Whichever one you want, you people can choose and draw for your records or the exam. So this is again well circumscribed. I'm finding the epithelial pearls. There is a central area of keratinization that is seen. The next lesion will be a basal cell carcinoma. A basal cell carcinoma. When a history is given, maybe this kind of a picture or a kind of a rodent ulcer, which is recurrent but not spreading, can be so. Here I find a well circumscribed lesion, hardly about 1 centimeter or 1.5 centimeters in diameter. The edges of the ulcer are raised, and I'm finding a small crateriform ulcer over here, and the floor is showing necrotic debris. This is typical of a rodent ulcer, and that can be another name in the question paper. Look at this one. I have drawn a line from over here, and this is the rat, the rodent. These creatures have got a habit of burrowing. So also the tumor, it digs deep into the tissue and a little bit into the surrounding tissue, causing a hole. That is why it is called a rodent ulcer. And it occurs from the basal cells of the epithelium. Hence, it is called a basal cell carcinoma. Why am I showing this handsome man over here? There is a hat that he is wearing, and the hat is supposed to be providing a shade up to this region. Therefore, normally in the forehead and so I will not be seeing it. Look where exactly it is being located. This is at the inner angle of the eye, or sometimes in the ala of the nose, outer angle of the lip. These are common sites for basal cell carcinoma because they are all sun-exposed areas, and such a hat and an agricultural person can be commonly seen in Australia, which is directly under the sun. It is an equatorial country. And coming to the microscope, this is a normal squamous epithelium of the skin, and this is a tumor. The tumor, I find that it is bluish in color because of small dark nuclei and also a basophilic or amphophilic bluish colored cytoplasm. What is important? I have drawn a circle over here. I find that all the nuclei are all parallelly arranged. This is called a palisading arrangement. Palisading means it is a picket fence like. It is parallel just like your fingers. So it is called a palisading arrangement. The tumor can be seen as a solitary one, or in this case, I am finding multiple nests. Nest means it is a collection of cells. Trabeculae means it is a strand of cells. So there can be nests and trabeculae of cells are seen, and this is a normal stroma. And if you go to each one, peripherally they may be showing a palisading arrangement, which I have highlighted in this case. I hope you people are able to appreciate it. Small basal cells and the nuclei are all close to each other because the cell itself is small. Not much of pleomorphism is seen. So this is classical of basal cell carcinoma. We have seen a squamous cell carcinoma and basal cell carcinoma. I think this picture alone is sufficient for us to distinguish between the conditions. The third and most important one is malignant melanoma. Malignant melanoma, it can be kept as a specimen for us. Look at this one. This is a lesion. It is black in color. The surrounding region is brown in color. And I find, in fact, it is called a play of colors. It is not a single color, but multiple colors are seen. This is called a play of colors. Classical. Whereas if you have a mole, a black mole, it will be exactly black in color, very well circumscribed, no changes. And this is a toe that is having a malignant melanoma. Obviously, it would have been amputated. Otherwise, this is a specimen of a lymph node. Any of this can be kept in your center. Kindly see where it applies. This is a lymph node and it is showing multiple blackish discoloration. It is a deposit of malignant melanoma. Microscopically, what do you see? You find that this is the tumor. The tumor cells are in fact large. This whole thing is a tumor. These are the nuclei and they show prominent eosinophilic nuclei. Prominent eosinophilic nuclei. The cytoplasm will be having coarse black or brown pigments. That is melanin. In some cases, they can obscure the entire cell. This is a malignant melanoma. You can get this as a slide or you can get it as a lymph node metastasis. This is another picture over here. I find that almost, I think it's a lymph node which is showing multiple deposits of tumor cells with melanin pigmentation. These are my sources of references. I would like you people to kindly go to R.A.T.S, tips and game. Now, one question for you. Can you mention any special strain for melanin? The answer is Mason's Fontana. Mason's Fontana, it provides a black color or a DOPA reaction, dihydroxyphenylalanic. DOPA reaction. So these two will be providing a black color, and there can be a lot of questions. I would like you people to kindly go back to my theory books in which I would have described the different pigments and the modes of identifying them. See you in next class. And In this, I hope you people are able to recollect the entire gross and the microscopic picture of the three important tumors. Thank you.